Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're going to talk about knee pain, and we're going to show you the top 3 critical things you should do right now. All right, these are the things that when I get a knee patient, these are the things I go over with them the first day.
Sure.
These are the things you want to do to try to help calm things down and get things so that the knee pain goes away.
Right, and the healing starts.
By the way, if you are watching this on YouTube, the rebroadcast, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, and pain-free, and we upload every day. Subscription button here or over here. And if you're not on Facebook yet, we're saying hi, by the way, to the people who are on Facebook. Howdy, howdy. Likes and heartsies and likesies.
Get those things
and
bouncing
thumbsies.
across the screen.
Yeah. If you aren't over there already, make sure you do. Brad and I have a real deep desire to be liked, and we also like all of you, so we'll return it in favor.
There you go. What goes around comes around.
All right,
Okay.
First thing, Brad, when you're having knee pain, the first thing you need to do is get things calmed down. And this, the nature of knee pain itself, if it's arthritis or and really anything, if it's a meniscus or even Patellofemoral Syndrome, it tends to flare up and it tends to calm down.
Sure.
So you need to see what you're dealing with. So you need to get it to calm down. One way to get it to calm down, if you're a younger person, is maybe use crutches or a crutch. If you're an older person, you might want to use a cane.
Sure.
And I know, I can't tell you how many people, they'll come in and they're in their 50s or 60s, and I'll say, if you used a cane for a while, it'll make a big difference. And they look at me like I just told them, I'm from Mars, because they're not going to use a cane. But it really makes a big difference. If you feel better using a walking stick, or a carved stick, something that's maybe makes you look like an English gentleman, you could do that. But it makes a big difference. I've had people that, Brad, literally got better, their arthritis felt better just from using the cane.
Because it takes weight off the joint, therefore not irritating the tissues, and it gives it a chance to calm down. Just quit irritating it.
And the thing about arthritis, you need to understand about arthritis, people think, I have arthritis, it's just going to keep getting worse and worse. No, they've done studies on it, Brad. After like a couple years, they've seen some people that actually their arthritis got a little bit better.
Sure.
And some stayed the same. Most got worse, maybe like 60%. But don't automatically assume that it's going to just keep getting worse and worse.
It's not always a dead-end road.
No, it's not. Do you want to show how to use a cane, Brad?
Sure,
just real
Bob.
quickly?
Yeah.
This is the Hugo, and this is the Hurricane. Remember the one thing we didn't like about the Hurricane, Brad?
Yeah.
I don't know if you can see this, Lonnie, but if you step on it, it actually could come loose when you're walking.
So yeah, it's a good cane, but that's a possibility. First of all, make sure it's adjusted right. If you stand with your arms down, the handle should come at the crux of your hand. So that's too tall for me.
It should hit you right on the wrist.
Yep, right there.
Yeah.
Right there would be good. I'm going to use it at this height, even though it's a little tall, just to save some time. So here I got my right leg. I got the brace on. There's a sore one. I'm going to use it in my left hand, the opposite of the leg always, and the cane goes with the sore leg. And typically what I do with people, I just give them the cane and I tell them to use it in the hand they should, and automatically
I tell them to walk.
the sequencing just falls into place. If I verbal kill them, I say, make sure the cane goes with this foot, then they think about it, and then it gets confusing.
Yeah.
So just walk with it normally, and chances are automatically your body will do what it's supposed to do.
You could do it like Dr. House, too. If this is my sore knee, you can do the limp along thing like this if you want.
Right.
So,
Yeah, good old Dr. House.
Brad, by the way, does have a brace on. Yeah, braces are fine. You could try a brace, because I don't think it makes a huge difference in a lot of people, but it does make a difference.
Right.
Generally, it does, do a little bit of things for calming it down.
If you put it on and it feels better when you walk and it just makes you feel more relaxed, I would wear it. Try not to depend on it for long term. It's just for that initial phase of being sore, and as you get stronger, you take it off.
By the way, if you have some questions on Facebook, we'll try to answer those at the end of the program here.
Sure.
We're going to go through the program first, and then we'll address those issues. All right, the next thing, Brad, so you try to calm things down. Now, so the next thing we're going to do is we're actually going to do a couple of different treatments you might try. One is range of motion / stretching. You're going to try to get a little more motion in it. And the second thing is you might try some massage, depending on what you have.
You mean to get it,
To get this is actually treatment now. So a lot of times what we find out if you have an arthritic knee, or maybe even a knee with a meniscus problem, sometimes you're lacking motion. And when you lack motion, what happened to my stool, Brad?
Oh, here it is, Bob. Fear not. Fear not.
So if your knee doesn't straighten out all the way, let's say you put up, both legs like this, and one knee is up like this and the other knee is straight, that lack of motion there can increase your pain. You're not spreading the forces out completely when you're using the knee, and that's going to make things worse. So you're going to want to regain that motion. Same with bending, Brad. If you can bend one way up here and the other one only goes this far, you want to regain that motion.
As long as you can do it within reason.
As long as you can do it without increased pain.
Right, and Bob's going to show you a couple of tricks for that.
Yeah, let's first start off with the one, let's say that doesn't straighten out all the way. Again, we're going to go ahead and put it up on a stool.
Why don't you pull your pant leg up?
Oh, yeah.
It's a lot easier to see
Yep,
in the
you're
camera.
right. Yep, good point. So I'm going to do what we call pressure on, pressure off. I'm going to push down. You can push on both sides of the knee like this, and push down, pressure on, pressure off. Pressure on, pressure off. We actually have you say the words, because when you say the words, that tells you how long you should do it.
I'm not doing this to compare legs, but I just wanted to show you the profile, because from that angle, you may not see it as well. But
You got more of a tan than I do,
well,
Brad.
Bob, I've been out tanning. You know how it is. Eating bonbons and stuff like that. I got some paint.
So
on
the other
my
thing
knee.
you can
So
do,
he's doing this.
by the way, you can do straight. You can do it with the toe straight up, and then for a little variation, you can also try turning the foot out a little bit, and then pressure on, pressure off, and you can also turn the foot in this way, pressure on, pressure off.
Just remember, pressure on. If it puts you in the sharp pain, don't get the idea, no pain, no gain, and try and push through it.
That's where you may actually try the variations of it. Let's say it hurts straight on, Brad.
Yep.
Then maybe try it a little bit straight out this way with it turned out, and then try it the other way and see which one is the least amount of pain.
Right.
But if you can regain even a little bit of motion, quite often that decreases the pain in the knee. I've seen it many, many times,
Okay.
Brad. All right, flexion is the same thing. You can actually work on bending the knee. So we're going to go ahead and we're going to work on getting more bend in the knee. And this is a mulligan technique we're going to try here. Actually, Brad, do you mind if I use that stool?
I do not mind.
So this works out well for me for this height. So what you're going to do is you're going to work on, you're going to grab the lower tibia here, the bones right here, and I'm going to turn them. I'm going to turn them this way. If you want to show, Brad, it's actually counterclockwise.
Sure.
So you're turning it that way, and on yours would be the other one.
Oh, that's right. I got the other leg
You
on.
got the other leg up.
That happens with therapists.
Yeah, we're turning it in towards the other
Right,
leg.
This direction.
Yeah,
I'm sorry.
So I'm going this way, counterclockwise, and I'm going in, and I'm bending my knee at the same time while I'm doing this. And this will work sometimes if you have a little bit of junk in your knee. Let's say there's little
Junk, huh?
well, they call them mice sometimes when the meniscus have broken off a little bit.
Right.
And
Floaters. is that-
floaters.
Yep.
It sometimes can help push it back into the spot it should be and even reabsorb.
Sure.
Now again, the whole thing with this, you're going to turn and you're going to hold it the whole time you're bending and the whole time you come back again.
Okay, so that constant rotation.
Constant rotation while you're
Okay.
doing this, and critical, it can't be painful. It has to be pain-free.
Okay.
Absolutely no pain. So you can do a good set of 6 to 10 of these, and you can do them twice a day.
Sure.
And you can see if that starts increasing your knee motion and starts decreasing your knee pain.
Right.
Again, works with a good percentage of people that we have, Brad.
Sure.
It works out really quite well. So, when would you try massage? I'll take this back now, Brad.
All right.
If you go to your knee and you find that there's tenderness right below the knee on the tendon right here, you're going to try some cross fiber massage on that. You're going to just rub it right across the tendon here.
And that's that little hollow spot, but you can feel the tendon there.
It's going from the kneecap, the tendon attaches to the tuberosity here. Now the other spot that often, this is the one I had, is a little quadriceps tendonitis. So I was tender above the knee right here. And that often responds really well to massage too.
And look at the direction he's going. The fibers of the muscle go this way, and it's a cross fiber, so you go
Now,
90 degrees.
Quite often with this, it takes so much work that you get fatigued in doing it. So like we have the the Pure Wave massager here. This works really good for this. This is what I used on it. And I just worked it back and forth like this. And with this setting, that softer setting, I could go right into the kneecap and didn't even hurt.
Yeah, so the head of that massager's got a little cushion to it, so when you hit the bone, it doesn't irritate it and get painful.
Right. And it's got a pointier one too that you can actually do. You can work on the tendon underneath. So we have that one. We have a cheaper one here, a less expensive one, the Nursel massager. If I remember, I'll try to put some links down below, Brad.
Sure.
But again, this one works back and forth. You can work it on the quadricep. Boy, that really works it well.
Yeah, that one has a little bit different mechanics
Yeah.
to the massage, so it may be have its own benefits.
All right, if there's no tender spots outside the knee, it's all inside the knee, massage is not going to help.
Yeah, if it's in the joint.
Yeah. The other one I missed on range of motion, Brad, is if you're having a Patellofemoral Syndrome, which it's really under the kneecap itself, you do want to stretch that kneecap because a lot of times it's tight.
Sure.
Especially it's tight on the outside here. So a lot of times I know this is really creepy to a lot of people. They don't like pushing their kneecap. But if you get onto the edge of the kneecap, and I'm going to push it this way and stretch it.
Yep. Now, the thing critical about this is the kneecap will not move unless your quadriceps are completely relaxed.
Right. You can't be tightening up your knee while you're doing this. You won't.
And a lot of people are kind of have a lot of anxiety about this, and they're not even aware that their quads are tight. So I'll have to tell them, just relax, relax, and all of a sudden when you relax, the kneecap starts to move.
Quite a difficult one for to do. They can stretch it that way. You can actually stretch it down toward the toes, Brad.
Sure.
And you can actually stretch it up to the head too here. 4
different directions.
Yeah, and that's just, especially, if you have what we call kind of globally tight kneecap, you get all the directions. One thing I missed, Brad, by the way, when we talk about ready to calm things down, we could have used the ice pack, couldn't we?
I've noticed I sat right on it, it's kind of cold. It's like, yeah, when you're exercising it, or later in the phase of it starts to swell up a little bit, maybe overdid it, you went for a walk, you went too far, get the cold pack out, and a nice gel cold pack, and wrap it right around. Boy, that feels even good on a healthy knee, Bob.
Yeah, and sometimes if you're worried about, because sometimes there's not a lot of, fat or protection underneath the kneecap itself, sometimes we do fold up a paper towel and put it right on the kneecap and then put that over the top of it so it's a little less sensitive. That's up to individuals. If they get too red around the kneecap.
Yeah, when the bone, that patella gets too cold, it can be a little uncomfortable.
So step 1 is we calmed it down. Step 2 is we treated it with range of motion or massage. And now step 3 is you want to start some strengthening.
Right.
So kind of the universal ones, Brad, is that we start is usually isometric, where we start with a straight leg raise.
Sure.
So if I'm on the mat here like this, and I'm just going to go ahead, I'm strengthening this one right here. I'm going to go ahead and just lift it up like this, and you can do hundreds of these if you want, to be honest with you, Brad.
Well, that might be exaggerating, but
when I have young patients, athletes, I tell them they can do hundreds of these.
Really? Okay.
Yep, literally, because it's not that much work.
Yeah.
And it's when they're laying around watching TV, they can go ahead and do this.
Sure. And he's got the knee straight. Quadriceps are really working, and
so then I'm going to go on to this side, strengthen this one. You can go ahead and off to the side like this too. I know we're getting hip here too, Brad, but we're getting across the IT band. You can go onto the stomach, and you can get up this way, and we're starting to strengthen this way here too.
Getting the hip back here, a little hamstring in
Little
there.
hamstring. And then the final one, it's called 4-way because you're in 4 directions. You can actually go up this way here too.
All 4 quadrants.
So now beyond that, you can start doing, do you want to show shallow squats or
Sure.
should I, Brad? Maybe that fits me better, huh?
Yeah, it does on that
You want to
wall.
watch the Facebook to see if we're...
You bet. I'm getting right in the way. I'm blocking people's view, Bob. They're probably getting nervous and excited.
Now, with most knee pain, you can do shallow squats. You don't want to do real deep squats, but you can do shallow ones and still not have pain. These are what I did for my quadriceps tendonitis. So I put it against the wall. These are really nice because you can put the feet forward, and the knees aren't going beyond the foot when I'm doing the squat.
Now, Nancy's asking about if people are balance challenged. You could do this one if you're balance challenged, particularly if you use a cane and you're leaning up against that wall.
And this is why it does work well for balance challenge, as long as you have some good tennis shoes on.
Right.
Because Yeah, the ball is going to give you support. And again, you just do shallow squats. My wife and I, we do lots of these. I mean, she had a hamstring issue and it just took it away because she does this so often.
Sure.
It's
You
helped
bet.
strengthen it up. So the other one that was nice with the ball is you can actually do some hamstring strengthening. So you just lay down on the ground like this and you get the knees fully straight, and then you can work on, you can do it first without even lifting your butt up. You can just pull it back and forth like this.
Yeah.
And
And
then
once
you can-
again, Nancy, this you don't need balance for this. You're laying down.
Right.
It eliminates that part of the equation.
And now I'm lifting the butt up, which makes it harder. Now I can put one foot on the other, which makes it really hard on one of them. And the last progression is to go ahead and lift the foot up like this and really lift the butt up. And
You're
this
in good
works.
shape if you're doing that.
Yeah, that one will work the hamstrings really well. You can also do shallow lunges. So you can actually just do, lunges like this where you're bending down like this and bending down like this. Again, it works out well to have something to hold on to while you're
Right.
doing those.
Yep. That's where even a cane or something. Monique from Canada says hi to us on
Hi,
the
Monique.
Facebook.
Any
So-
other questions on Facebook?
No, that's all we got right now,
Okay.
Bob.
All right. Well, thanks everybody for watching. And remember, Brad and I can fix just about anything
Except
for a broken heart,
here it comes.
but we're working on it. So, thanks.